The urgent race to vaccinate so many Americans right now, more than 25 million people have received at least one vaccine dose out of the nearly 50 million shots distributed. We're joined now by Dr. Stephen Hoge. He's the president of Moderna, which produced one of the vaccines now being administered across the U.S. Good morning, Dr. Hoge. Thanks for joining us this morning. As you know, we're in a race now to get as many vaccines as possible to as many Americans as possible, as soon as possible. Is there anything more Moderna can do right now to ramp up production?
Well, absolutely, and we're doing it as best we can. I mean, one of the big challenges is this has moved from a science exercise to really an engineering one. And like any complicated supply chain, there are many steps in making a vaccine that you need to plan for. And as you ramp up production, you run into bottlenecks, and what you need to do is attack those bottlenecks and develop solutions. And we've been doing that, as have the other manufacturers, really around the clock since the vaccines were first approved. And that's why you've seen this steady, hopefully progressive increase in the number of vaccines that have been delivered. And our intention is to keep working that problem until we get as many vaccines out into the American people as are needed.
Is there anything more you need from the government right now, you need from President Biden? Would the Defense Production Act help at this point?
Well, at this point, a lot of the logistical bottlenecks that we're running into are problems we can solve on our own. But what's been great is we've had partnership from the administration throughout and have been able to work with them to identify if there have been any supply chain gaps, any consumables, any small things that we need. We've been able to ask for it, and they've been able to help us arrange relatively quickly access to those. So at this point, nothing dramatic more, but we're in good shape.
But as you do that, of course, the variants are multiplying across the globe right now. We have the UK variant, we have the South Africa variant. I know you're trying to develop a booster to combat one of the variants. What difference will that make? What more needs to be done to address these variants, which are in a race with the vaccines?
It's a great question. I mean, it's important to put a little context around this. You know, a couple months ago, we didn't have anything but hope that vaccines might work. And where we are right now is we've got 2 authorized vaccines and perhaps more on the way that look excellent, like they can control the virus and actually help us beat back this pandemic. But as we follow the data in the pandemic, what we do see is some of the new emerging strains are better at hiding from those vaccines. Now, right now, the good news is the vaccines look like they work against all of the emerging strains. That's good news. But there are a couple, and you mentioned one, obviously the South African one, is of some concern because it looks like it could hide from the vaccine a little better than others. So our approach at Moderna is going to be to develop a booster vaccine so that if the South African variant or any other variant becomes a concern, we'll be able to offer a way to identify that, prevent it from hiding from the vaccine.
How do you develop antidotes or ways to address variants that you don't know much about?
Well, we do know, because of sequencing information, what the variant looks like. And that's actually one of the great advances that's happening in science globally associated with the pandemic. So actually, we do know what it looks like. And it's it looks like a close proximate of the wild type virus. What we then are allowed to do as a result of our technology, mRNA, is actually copy and paste that information into our vaccine cassette and then just start adding it to the vaccine so that your immune system, when you get the vaccine, will also be able to identify the variant.
All of that is going to take some time. In the meantime, we could be facing these emergency situations. Some experts, like Dr. Michael Osterholm, have suggested delaying the second dose to get more people the first dose. Is that a good idea?
Well, at this point, as a scientist and physician, I focus really on what the data says. And the data we have from our clinical trials shows that 2 doses is excellent, very good at protecting against COVID-19. And ultimately, that's the only regimen that we've really studied. Now, it's possible that 1 dose would provide some benefit, but we really just don't have any data to prove that at this point. So as Moderna, we try to stick to the data and the science of what we have. Ultimately, public health officials do have a complicated choice to make, which is, in a limited supply environment, how do you protect as many people as possible? But our responsibility as a company is to stick to the data and make as many doses as we can available.
You're also asking the FDA to increase the number of doses that can fit in a vial from 10 to 15. What difference will that make? Do you expect it to be approved? Is there a bottleneck there?
That's a great question, George. It's one of the bottlenecks we've identified. So as we've ramped up production, closing in on 1 million doses a day, what we've identified is that one of the big bottlenecks we have is getting those doses into a vial. It's not actually making the vaccine dose, it's getting it into the vials themselves, because there are capacity constraints in how many doses how many vials that can get filled. And so one of the solutions that we're proposing, but ultimately we do need to discuss this with regulators, is to actually just put more doses in the vial. Instead of 10 doses, put 15. And ultimately that might relieve that bottleneck. Hopefully then the bottleneck moves someplace else and we'll go tackle that one. But ultimately, we do need to talk to the FDA and make sure they're comfortable with that approach.
We know the vaccine protects people. We know it prevents them from getting seriously ill. What do we know about whether the Moderna vaccine prevents transmission of the virus?
So the data is still emerging, and I think what we're all waiting to look over the next couple of months is all of these vaccines, how do they do at preventing transmission? What we do know from the phase 3 trial is that when we did look at the rate of infections, asymptomatic infections, in people in the first month after receiving the first dose of the vaccine, there was about a 2/3 reduction in the rate of those infections, which is really what's important for transmission. So we're quite hopeful, that was just after one dose, we're quite hopeful that actually after 2 doses we may do even better than that. And the good news is if that's true for our vaccine and others, we would actually see the pandemic slow down even more dramatically.
So try to set expectations for everybody right now. When do you expect enough people here in the United States to be vaccinated enough to create herd immunity?
Well, it really depends on what you think herd immunity needs to be, but if you assume 50 to 70% of the population, then we're working hard ourselves and the other manufacturers to make sure that's a possibility really in the late spring, early summer. It's ultimately going to depend upon the delivery of those vaccines, and so that's something that the states and the healthcare providers in this country are ultimately leading the way on, as well as Americans deciding they want to receive that vaccine. But we're optimistic that by the middle of the year, we'll be able to achieve those sorts of numbers.
Dr. Hoge, thanks very much for your time and your information this morning.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.